Hello everyone, today I'm going to talk about symptoms of depression and treatment for depression. But firstly, I'm going to give you a brief explanation about what is a depression. Depression is one of the mood disorders and one of the most common disorders. Depression is a mental health problem that involves having a low mood or losing interest and enjoyment in things. It can also cause a range of other changes to how you feel or behave. Everyone experiences sadness at times, but depression is something more than that. Depression is extreme sadness which takes more than days. It affects on the activity of daily life and can cause physical symptoms. The negative mood state is the one features of depression. Depressed people feel sadness, misery, and loneliness. Activities that used to bring satisfaction and happiness feel dull and flat. Even biological pleasure, such as eating and sex, losing their appeal. Bodily pain, weight loss or gain, sleeping pattern disruption, or lack of energy are depression symptoms as well. People with depression may also experience an inability to concentrate, feeling of worthlessness or excessive guilt, and thoughts of death or suicide. Many people with depression also have symptoms of anxiety disorder like generalized anxiety disorder, which is a state of anxiety that is not attached to a specific situation or objects. We have three symptoms for depression. The first one is cognitive symptoms, which are a central part of depression. They usually have low self-esteem, believing that they are inferior and incompetent. When setbacks occur in their lives, depressed people tend to blame themselves. When failure has not yet occurred, they expect that it will and that it will be caused by their own. Depressed people almost always view the future with great hopelessness. The second one is motivational symptoms in depression involve an inability to get started and to perform behaviors that might produce pleasure or accomplishment. A depressed student may be unable to get out of bed in the morning, let alone go to class or study. Everything seems too much of an effort. And the third one is bodily or somatic symptoms, which often include loss of appetite and weight loss in moderate and severe depression. Whereas in mild depression, weight gain sometimes occurs as a person eats too much. Sleep disturbances like insomnia are common as well. There are two major classification systems in use for psychological treatment around the world. The first one is World Health Organization International Classification of Diseases, and the second one is Diagnostic and Statistical Manual of Mental Disorders. There is a list of treatment for depression disorders, which is psychodynamic, humanistic, cognitive, and biological treatment. Psychodynamic therapy helps you understand how your current feelings and behavior are shaped by your past experiences and your unconscious mind. Freud's psychoanalysis theory is help clients achieve insight, the conscious awareness of the psychodynamics that underlie their problems. Such awareness permits clients to adjust their behavior to their current life situations rather than repeating the routines learned in childhood. There are four major schools for psychoanalytic theory which has influenced psychodynamic therapy. The four schools are Freudian, ego psychology, object relations, and self psychology. Gestalt theory by Perls is believed that developing an awareness of one's feelings, reactions, and thoughts in a present situation could resolve personal issues. In other words, people have the ability to solve their own problems. Gestalt therapy focuses on a person's present life rather than their past experiences. And a person-centered counseling was founded in the 1940s by the American psychologist Carl Rogers, who believed that given the right conditions, a person can reach their full potential and become their true self, which he termed self-actualization. When you're attending counseling session with a person-centered counselor, you will be encouraged to bring your own issues to the session. The counseling is led by you and not directed by the counselor. Many clients who know prior knowledge of the counseling believe that the counselor will sort their problems out for them. A person-centered counselor will help you to explore your own issues, feelings, beliefs, behavior, and worldview so you can become more self-aware and achieve greater independence. Rational emotive behavior therapy is a type of cognitive behavior therapy or CBT that aims to help a person challenge unhelpful thoughts to avoid negative emotions or behaviors. Rational emotive behavior therapy started in 1955 when Dr. Albert Ellis created the therapy as an action-oriented type of CBT. In the 1960s, Aaron Beck developed cognitive behavior therapy. Cognitive behavioral therapy, or CBT, is a talking therapy that can help you manage your problems by changing the way you think and behave. CBT aims to help you deal with overwhelming problems in a more positive way by breaking them down into smaller parts. Unlike some other talking treatments, CBT deals with your current problems rather than focusing on issues from your past. It also used for serious mental disorder treatments such as bipolar disorder and schizophrenia. Antidepressants are a class of medications used to treat major depressive disorder, anxiety disorder, chronic pain, and addiction. Common side effects of antidepressants include dry mouth, weight gain, dizziness, headache, and sexual dysfunction and emotional blocking. ECT, also one of the treatments, can be useful in treating severe depression, particularly if there is a high risk of suicide. It can be useful where drug use is not effective.